See, in this question, on the basis of X-ray, you have to mark the answer. Whether there is any defect in intramembranous ossification or inchondral ossification or any kind of bone problem. So first of all, look at the X-ray, and now you tell me, what do you see in this X-ray? What is special about this X-ray? Okay, I was taking the same lecture in my class, and one student told me, sir, there is a safety pin. I said, wow, very good, right? So what is your observation? What do you see here? What is special about this X-ray? There is no clavicle. See, no clavicle, absence of clavicle here, no absence of clavicle. So it will be causing what kind of condition where the patient will be able to touch the shoulders also. This is a case of cleidocranial dystosis. Remember here, on the basis of your first year information, there are two types of ossification. One is called as inchondral ossification. This one, inchondral ossification, and second is intramembranous ossification. Okay, all short and flat bones are formed with the help of intramembranous ossification, but all long bones are formed after inchondral ossification. Now you tell me, see, clavicle is a long bone or a short bone? See, clavicle is a long bone. See, clavicle is a long bone. Remember, all long bones are placed longitudinally except clavicle, which is placed longitudinally. Remember, all long bones are formed out of inchondral ossification except clavicle. Remember here, except clavicle, which is having what? Intramembranous ossification, clavicle. So here there will be defect in intramembranous ossification. If there will be problem in inchondral ossification, right? If there will be problem in inchondral ossification, remember, so yes, it can lead to achondroplasia, and this is a case of cleidocranial dystosis. I hope all these points are clear to everyone. Okay, related to this topic only, related to bone, we can learn some more topics. Okay, if I ask you in an adult, what is the hematopoietic organ? So you can say, sir, a bone marrow. Okay, fine. Bone marrow, short bone or long bones? You can say, sir, adult or long bones only? No. Bone marrow of short and flat bones. First of all, let's understand, in a case of intrauterine life, up to 5 months, it is yolk sac. It is yolk sac. Okay, after 5 months to birth, liver, spleen. After birth to the puberty, after birth up to puberty, bone marrow of long bones. But after that, after puberty, see here, red cells will be replaced by the fat cells, by the yellow cells in the long bone. So in adult, please remember here, after puberty, bone marrow of short and flat bones. Short and flat bones. Please remember all these points. So in this manner only, if I ask you, what is the best bone for the bone marrow aspiration in adults? Bone marrow aspiration in adults. Okay, this is hip bone, ischial bone, right? Hip bone, you can say, flat. After that, sternum, right? But if I ask you, what is the best bone for the bone marrow aspiration in a child? Long bone, right? Long bone. So in a child, it will be, or you can do bone marrow aspiration from tibia. Now, in the same manner, suppose if there was a case of road traffic accident where a 25-year-old man suffered femur fracture, shaft of femur fracture. After that, he was shifted to hospital. On day 1, he did not get surgery because of some kind of machines problem, OT problem. On day 2 also, he did not get operated. After that, on day 3, when he was shifted to operation theatre for surgery, suddenly he started having shortness of breath, and after few more minutes, he went into coma. Now you tell me, What is the condition here? This is a case of what? This is a case of, yes, now you can say this is a case of fat embolism. Please remember here that, see, first of all, fat embolism, because of that, after that, there will be the pulmonary embolism. There will be obstruction of the blood vessels. So my question is that whenever there will be fracture of long bones in adults, fracture of long bones in adults will always be the surgery of emergency. Surgery of emergency, because see, when I talk about shaft of a femur, mostly there will be yellow cells. If you are not going to operate, that yellow cells can come into systemic circulation, and in the main arteries there can be obstruction, right? No, and finally it can lead to embolism, right? It can lead to embolism. Please remember, fat embolism happens after 48 hours. 48 hours of the bone fracture. But in a child, if there will be shaft of femur fracture, we can wait up to few days. Easy to understand? I hope all these points are clear to everyone.